Good afternoon. My name is Daniel Beem, and I'm a Regional Long-Term Care Ombudsman here for the State of Connecticut Long-Term Care Ombudsman Program. Thank you for joining me tonight for this educational series, and I'm going to work to guide you all with some tips and tricks on how to choose a nursing home. So whether you're hoping to find an appropriate place for short-term rehab after an operation or hospital stay, or exploring the potential of going into a nursing home for long-term care, the process and systems can often seem convoluted, daunting, and downright overwhelming. Some individuals report that this is one of the hardest decisions they ever make. So when it becomes necessary, it is vitally important for prospective residents and their families to have the best information possible to make this decision. There are many resources that can help, and the purpose of this presentation from our program is to help you navigate those resources, understand the information, and make an informed decision on what's best for you and your loved one. So come with me as we take a look at this concept. Alrighty. So we'll start today by looking at the program and where we'll be going. So we'll start off today by learning about what long-term care really is, who gets it, and where they can receive it. Once we have a grasp of the general concepts, we'll talk about ways that you can plan ahead to confirm that nursing home placement is the right choice for you. If, after exploring the possibilities of the various service delivery systems, you find that nursing home placement is the right step, I'll give you tips and tricks on who to talk to, what to ask, and the tools to use to narrow your search on finding the right home for you and your loved one. Once you have your list of prospective homes in hand, we'll change gears and I'll focus on ways to ensure that your visits to potential homes are enlightening and illuminating so that you can feel good about making your choice on where you may wish to apply. Now, it wouldn't be a real fun Ombudsman education series without noting the residents' rights and highlighting some of the key statutes and regulations as they pertain to the application process. I'll then wrap up the program noting some fantastic resources and ways to ensure that you get good quality care once you've been admitted. So without further ado, let's get started. So what is long-term care and who needs it? Many people think that the phrase long-term care refers to an insurance policy. Now, while insurances may be part of your strategy, long-term care encompasses everything from long-term services and supports and finances to where you will live and how you will navigate the myriad of legal, family, and social dynamics along the way. Long-term care, again, is a range of services and supports that may need to use to meet your personal care needs. At some point in our lives, 60% of us will need assistance with things like getting dressed, driving to appointments, or making meals. Planning is critical, but many people are not sure what's covered by insurance, and people are often misinformed about what's covered by Medicare. So in the year 2000, almost 10 million people needed some form of long-term care in the United States. Of this population, 3.6 million, or 37%, were under the age of 65, and 6 million, or 63%, were over the age of 65. Research suggests that most Americans turning age 65 will need long-term care at some point in their lives. So as I mentioned in the last slide, long-term care is a range of services and supports that you may need to meet your personal care needs. Most long-term care is not medical care, but rather assistance with the basic personal tasks of everyday life, sometimes called activities of daily living, or ADLs. These things usually are referred to as tasks like bathing, dressing, toileting, transferring to or from the bed or the chair, incontinence, or eating. Other common long-term care services and supports are assistance with everyday tasks, sometimes called instrumental activities of daily living, or IADLs. These tasks are typically things like housework, managing money, taking medications, preparing and cleaning up after meals, shopping for groceries or clothes, using the telephone or other communication devices, caring for pets, or responding to emergency alerts such as alarms. So where can you receive care? Well, most long-term care is provided at home. Other kinds of long-term care services supports are provided by community service organizations or in institutional long-term care facilities. So examples of home care are something like an unpaid caregiver who may be a family member or friend, or a nurse or home health aide that comes to the home. Community support services would be things like adult daycare, transportation assistance, or home care agencies that provide services on a daily basis or as needed. Often those services are supplemental to the care that you receive at home or provide time off for your family. Outside the home, there's a variety of facility-based programs to get your long-term services and supports. Nursing homes provide the most comprehensive range of services, including 24-hour nursing care and supervision. Other facility-based choices include assisted living, boarding care homes, and continuing care retirement communities. With these providers, the level of choice over who delivers your care varies by the type of facility, and you may not get to choose who will deliver the services, and you may have limited say in when they arrive. So to drive home the differences and caveats of what long-term care is and where you can receive it, I'm going to play this brief educational video put out by the National Institute on Aging last year, which summarizes these variety of services and settings to consider when planning ahead and looking at alternatives to nursing home care.
When people hear the words long-term care, they often think only of nursing homes. But long-term care includes much more.
Long-term care is a wide variety of services and supports to help meet one's personal and health care needs over an extended period of time.
The most common type of long-term care is actually personal care, services that a person receives in the home from paid or unpaid caregivers. Home-based care includes home health care, personal care, homemaker services, friendly visitor companion services, and emergency response systems.
Home-based long-term care is primarily care received in your home. It is generally care, as I just mentioned, to complete your activities of daily living. And again, that's bathing, dressing, and it also includes other activities that support you in your home. Shopping, meal preparation, getting to doctor's appointments. All of these things are home-based services.
Long-term care also includes services that are available outside the home, called community-based services. Community-based care includes adult daycare programs, senior centers, transportation services, meals programs, and respite care. Community-based care supplements services available in the home, making it easier for a person to live at home.
Community-based services are basically services that are available in the community. Generally, they supplement the services that people get and need in their homes, and they help people to stay in their homes. Community-based services include things like adult day care services, which are service programs that provide supervision and nutrition programs.
And look up at your elbow if you can. And then slowly press down with your big toes. Lift your knee.
Other community-based services include meal programs, transportation services to help people get around, and senior centers.
Senior centers are very important in the community. They are generally for kind of well elderly or elderly that don't need supervision, but they do provide social, recreational, and nutrition programs for people in the community.
When people are no longer able to live on their own and need full-time help, they may require long-term care in a facility, such as a nursing home. Facility-based care includes adult foster care, board and care homes, assisted living facilities, nursing homes, and continuing care retirement. Facility-based care is for those who require help and can no longer live on their own.
Nursing homes provide 24-hour housing, healthcare, and personal services, supervision 24 hours a day, and most nursing homes also provide rehab services.
To find out about long-term care services that are provided in the home, in the community, or at a facility, contact the Elder Care Locator at 1-800-677-1116 or visit www.eldercare.gov. You can also contact your local area agency on aging.
Great. So with an overwhelming majority of elders noting that they would prefer to age in place and receive their long-term services and supports in their homes in the community, it is no surprise that when looking at the data, we see an ever-increasing percent of individuals who are receiving their long-term services and supports in the community versus in institutions. This chart, provided by Connecticut Department of Social Services in partnership with UConn Health, the Center on Aging, you'll see that since 2007, there has been a schism and a separation of how many dollars, Medicaid dollars, are spent receiving individuals long-term services and support in the community versus institutions. So again, I think what's important to note here is just making sure that a nursing home placement is right for you. And what you want to do is, if at all possible, plan ahead for future long-term care needs. And an individual that is close can talk about preferences related to long-term care to help plan ahead. Decisions and arrangements are much easier to make for long-term care before the need arises. Before you look at a nursing home, make sure your loved one's condition and support system has already been thoroughly evaluated. When properly diagnosed and treated, some conditions may improve significantly, and also some people with serious medical conditions can remain at home with the proper support system. So talk with your loved one and find out about their wishes. Even if he or she has dementia and/or difficulty communicating, the prospective resident should be at the forefront of the decision-making process as much as possible. Since most people prefer to stay in their home, it's important to investigate alternatives to nursing home care, such as home care, adult daycare, or potentially assisted living arrangements. If you're not sure where to begin, no problem. Let me provide some resources and information to get you started as you explore. I'd like to note that this presentation will be posted on our website with a link to the PowerPoint so you can refer back to it and use it as a resource ongoing as you explore your options. So I'll start here with the Aging and Disability Resource Centers. These can provide information about the full range of available options, provide objective advice, counseling, and assistance to help you make informed decisions, and help you access public and private programs. ADRCs, as they're called, they provide unbiased, reliable information and counseling to people with all levels of income. Here in Connecticut, these are referred to as community choices. And you can contact them by dialing 1-800-994-9422. I also included a link of the brochure of services they provide. The next one to look at are the Area Agencies on Aging, also referred to as the AAAs. They coordinate and offer services that help older adults remain in their homes, if that is their preference, aided by services such as home delivered meals, homemaker assistance, and whatever else it may take to make independent living a viable option for them and their loved one. For people with disabilities of all ages, Centers for Independent Living, or CILs, are another great first stop. These are community-based centers that are run by and for people with disabilities and offer a broad range of services to empower people to live independently and fully integrate into their communities. And so, as I mentioned, it's never too early to start planning for your long-term care. And I can't stress this enough. Being educated about the costs and options you have when it comes to receiving long-term care and having a plan that you will talk about early and often with loved ones and help supports will make life a whole heck of a lot easier. Here are just a few simple things that you should know and can do today that will help making sure that any decision you make regarding your care and provision of services feel like the right one. So things you should know. Medicare only pays for long-term care if you require skilled services or rehabilitative care. And Medicare does not pay for non-skilled assistance with activities of daily living. As we previously discussed, they make up the majority of long-term care and services. So read ACL's site. I linked it here on Medicare to get some more information about this insurance. Long-term care, it's expensive, and you may think that it will likely be responsible for paying for the care that you require, but start thinking about how you'll pay and do some cost reports on what it would look like. Here, I also have ACL's cost and how to pay section for further information about that. And my personal favorite, and I'm telling you, I'd love to do an entire training just on this topic alone, because I feel like it is such an effective tool to families dealing with grief down the line. I'm talking about advanced care directives and advanced care planning. By obtaining an advanced care directive and establishing an advanced care plan, the individual, prospective resident or not, can inform their family or loved ones about how to make important health decisions for them, should you no longer be able to make those decisions by themselves. Consult the advanced care plan consideration page from ACL to get more information. And again, as I mentioned, I'd love to do a whole education series about that topic alone, advanced care planning. But in the meantime, just some food for thought as you consider creating these with individuals that you care about, or with your loved ones. Because these things are they carry over and they apply to looking for a nursing home as well. And I'll get to that in a bit. But asking the individual, what are your values and beliefs? Consider their concerns, values, spiritual beliefs. What does it make life worth living to them? What do they want for themselves? Talk about what life would be like to face a death or disability. Sometimes sharing your ideas or talking about the situations that other family members or friends have experienced can help in opening the doors to that conversation, including who do they want to be their decision maker? The person's going to want to choose a decision maker who understands them fully and is able to carry out their wishes, including the stopping of life-sustaining treatments. You should also name a backup agent just in case the first is unable to do so. And so I've got a whole list of some ways to get that conversation started, I'll say, and individuals' right to make healthcare decisions. And this kind of leads up to our next section, doing your homework and consulting with experts when evaluating facilities. Alrighty. So as we continue to, do our homework and evaluate facilities, it's a good idea to do some preliminary research before you actually start visiting the nursing homes. With the right information in hand, it will provide you with greater insights as you make your visits. Some issues to consider when evaluating facilities include the quality of care and life, the bed availability at a particular home, the provisions of services that the resident will need, the cost, and to ensure that the location is in an area where friends and relatives can visit with ease. When doing your homework, asking and talking to these types of individuals, such as nursing home residents and families, physicians, social workers, or hospital discharge planner, or clergy members, finding out what their opinions about the various facilities are. And you can also use other sources of information to help gain a deeper understanding of the facility. These include myself, the Regional Long-Term Care Ombudsman, and other citizen advocacy groups, the Nursing Home Compare website, and the state nursing home inspection reports themselves. So first of all, let's be clear. The best expert on what will be a good place to live is the prospective resident themselves. Ask them about what their preferences are. Who do they want to live near? Is it a particular family member or a friend? Is it their hometown? Do they have a preference, whether it be a small facility or a large facility, etc.? There's a million and one reasons or things to consider when you're talking about the individual. So by using a person-centered approach, and coming back to my favorite topic, advanced care planning, it's the best way to make decisions of this nature, because you're going to truly know the values and preferences which take priority for someone. Everyone is unique, and what matters most to them is just as unique as the caveats of the care that they're going to want. And the perspective and the desires of the prospective resident cannot be overemphasized here. And as far as the ombudsman, if you're not familiar with us, the ombudsman program is a state government-funded advocate, individuals for residents of nursing homes, residential care homes, and assisted living facilities. We're familiar with the local facilities, the staff, and the residents who reside within them. Some ways our program may be able to help in this process is to help you find and interpret information from state inspection reports and the resident characteristics or quality measures inside of them. I personally chose this topic to present on because I think a very powerful tool in this process is often not maximized to its fullest potential. And I want to give you a hands-on feel on how to navigate it. But more on that in a minute. Another thing to consider when considering skilled nursing facility placement is the cost. Similarly to reviewing the costs of care in the community, it's also important to prepare for how you'll be paying for your care at a particular facility. Most nursing homes participate in the Medicare and/or Medicaid programs, which reimburse them for part or all of the care that some residents receive. Medicare, as we discussed before, pays for post-hospital rehab care and hospice services for short periods of time, where Medicaid pays for nursing home care for longer periods for those who are financially eligible. Most nursing home residents, even if they pay privately when they first enter a home, eventually run out of money because of the high costs of care. They then apply and have the cost of their care paid for by Medicaid. So unless you are certain that a resident can pay indefinitely with private funds, you may wish to choose a facility that accepts Medicaid as a payment. So I'm going to talk now about this tool that I stand behind and I really appreciate, which is Medicare.gov Care Compare. So on Medicare's Care Compare website, nursing home data is provided by the federal government. And I personally love this site because it's super powerful, intuitive, and it's a way to take a deeper dive of skilled nursing facilities by using its data to help paint a picture of the care that's provided at a facility before you even walk in the door. It honestly reminds me kind of like Google Maps meets Yelp, but for all sorts of services, including, but not limited to, you guessed it, nursing homes. Interesting, right? So let's take a quick look at an advertisement and what Medicaid.gov would suggest in using the site for.
Looking for a nursing home for your loved one? Find and compare local nursing homes based on 5-star ratings, including inspection reports, staffing, and quality measures. Visit Medicare.gov to learn more. Paid for by the U.S. Department of Health and Human Services.
Great. So as we go on this site, you can search for nursing homes by city, state, county, or zip code. Once you've selected a nursing facility or facilities, you're given the option of viewing several different types of information, including facility characteristics, inspections, staffing levels, and quality measure information. But it's one thing to talk about it. Why don't we give it a test drive? And I'll walk you through how you may wish to use this tool as a way to gain a better understanding of which facility may suit you or your loved one's needs. All right, so bear with me. Switching it up here. All right, so I'll just get you back to the main page here. So you go to the Medicare Care Compare site. Once you're on it, you can choose. There's tons of options about what care you're looking for: inpatient, long-term hospitals, home health, dialysis, etc. We're looking for nursing homes. So, and I cover the Norwich region, so we're going to do a Norwich test run here. We're looking for a provider type nursing home. And once you're in, you're going to see that there's multiple different variables that you can filter by, by the distance, the overall star rating, other ratings about such as how they did in their health inspections, or more. And when you get in them, you're going to see on the right, you've got the map, and you can kind of pop around saying, depending on where you live, which facility is which. And so say we're looking in the New London region, a Fairview. So you pull up a home, here, and on the main page, you're going to see a lot of basic characteristics about a facility, kind of at a bird's eye view. Some things to note, The site actually just recently updated, so now it uses the CD or CMS data that facilities submit nationally to find out the COVID vaccination rate for staff and for residents. When you pull it up, you can actually see and compare it, for all of these metrics, the national average and the state average, and it's going to tell you, if it's a good thing to be higher than the average or lower than the average. So that's one thing to note. If you go down here a little bit lower, you can get, a little bit more detailed information. How many beds are there? Do they accept Medicare, Medicaid? Are they part of a continuum of care retirement community so that there's multiple levels of care? If you're going to start private and move your way to Medicaid, it helps in having that continuity. You can get the ownership information, the type of ownership, is it for-profit or nonprofit? You can even look up and run the Google Maps to see how far away it's going to be by the minute for your home. And so that's stuff that you're going to get. It's going to give you kind of that preliminary picture about what a home has for you. Some other, some things that you'd want to look at are the state survey information, right? And so here you can click on View Inspection Results, and it's going to pull up the most recent inspection that they have. So the star rating is going to be based on the last 2 years of inspections, as well as 3 years or so annually, and then complaints. So there's two different ways that the Department of Public Health, the regulatory agency overseeing nursing homes, will survey or investigate a facility. One is annually. Annual surveys are done, every 9 to 15 months, and they are preliminary. They go out. During COVID, they actually increased and started doing infection control surveys. And so as we scroll down here, you're actually going to see they have their infection control surveys are also posted that were completed. And here their complaints. So the other way, other than annuals, are complaint-related inspections. That could be from a resident or family member, or submitted by the facility themselves. And what's nice is you can compare the deficiencies at a building based on national averages. For example, here we've got, so 4, right? So the total number of health citations for this facility was 4. The average is 8.3 or 8.4. So they're a bit lower than the average facility as far as what citations you'll get. You also have the ability to actually pull up the specific survey that was done. And this is helpful because it's going to tell you the actual kind of deficiency that was found in the facility. So here, I'll just zoom in a little bit. This facility, for example, at their most recent survey that's posted, something I think is worth note is that, check the date of the most recent survey, because sometimes there may have been a more recent one. It's just not updated on the site yet. The nursing facilities are required to post their most recent survey findings in the home, in a easy to access place, public area for staff or for residents and families. So when you're doing a visit at the home, that's certainly something you can look for and review as well while you're there. But just kind of a general idea of reviewing a inspection report here. So, and if you watched our quality care training that Lindsay Jessup did, she touched on these F tags. These are the federal either resident rights or regulations that may have been found deficient during a survey, and can tell you a little bit more about some of the specifics. Some things are redacted, but you get a general idea of what the issue might have been. So in this survey in particular, this one of the F tags that they got is 0584. I'll look at my cheat sheet. Oh, actually, no, it's right here. That is the resident's right to a safe, clean, comfortable, and home-like environment. And when you look at this particular complaint that was substantiated, what you find is that upon survey, when the surveyor went in, they found that staff belongings, like a handbag, a lunch bag, and some water bottles, hooded sweatshirt, were left in a resident alcove between resident rooms. Upon investigation of the facility, although they didn't have a specific policy on the issue, they did note that staff items should be in a separate and distinct area and not in resident areas. And so, although, again, it's not the most severe citation, many residents were affected. And I think that the kind of deficiencies you're going to see in these reports speak to the type of complaints or maybe the star rating that a facility may have. Smaller citations may come up. They'd have to submit a plan of correction on how moving forward they're going to ensure that this doesn't happen again. But that's something to take note that you can look at those. You can look at the inspections, the health inspections as well. So let's see, any tips or tricks for this? Yeah, and so something to note that if you do find that a facility has a citation in a particular area, when you do your visit to the home, that could be something that you ask the administration about. Say, I noted that on your last recent survey, you were cited for failure to keep a home-like environment. What have you instituted to ensure that this kind of thing doesn't happen again? Engage their response and weigh that with many of the other pieces of the puzzle when you're considering a facility. Another thing you can look at, staffing numbers. When pulling this up, one, it's got the star rating for it, but it's also going to give you how many licensed staff, how many nurses, how many CNAs, and how many hours per resident per day are individuals getting care. Similar to the survey report, facilities are required to post the daily staffing numbers in the facility. So when you visit the facility, you also can take a look and see if they're staffing to those same levels while you're there. Because again, something to note, so for example, keep note of the CNAs that are on site per day and the hours that they work, because as we discussed previously, the daily activities of daily living make up 90% of the hands-on care that a resident gets. And so a facility that's providing higher than average CNA care is likely to maybe, it leads you to believe that they may be providing more individualized care to those residents. Also note those the registered nurses and the LPNs. Studies show, research shows that the higher RN averages you have in a facility, the more likely they're going to be able to handle complex medical needs of residents to ensure that their care needs are getting met in that way. Some cautions, of course, is just like the citation area. Just because they have a good star rating or they didn't find deficiencies doesn't mean that they're carefree and that there's not potential issues. It just means they haven't been cited or reported for it. Similar with staffing. These staffing numbers are facility reported. There is no way to independently audit them. There's no mechanism to do that currently. Another thing you can look at are the quality measures, the quality of resident care. You pull those right up. And these are defined by two different kind of aspects. There's the 14 indicators for quality measures for long-term care residents, and there are 5 for short-term residents. And this is a way, depending if you're going for short-term or long-term care, are they exceeding, meeting, or lower than national and Connecticut averages as far as, for example, long-term residents. What % of residents had a catheter inserted and left in their bladder, right? So this facility is 0%. Those are specific instances where you want to make sure that the facility is doing the right thing, because a catheter should only be used when medically necessary and not compensate for inadequate staffing or toileting needs of the facility. And so these are kind of things that you can look at ahead of time. Another thing that's nice about the site, I'll say, if we go back here, you can actually compare multiple facilities. So we could say, all right, I want to look at Orchard, Green Tree, and Fairview. And I'll note, if it has this red stop sign with the hand, they instituted this, I believe, last October. This means that a nursing home has been cited for abuse. So that's another consideration for a facility and ways to look. So you click a couple, I think you do up to 3 at a time, you can compare them. When you click compare, it's going to bring up all these same metrics side by side. You could look at the distance, you could look at their star ratings, how many beds, so on and so forth. So you have a pretty good idea before you even walk into the facility, how they're managing and what their care may look like once you're on the inside. So I'll leave that there. Again, a great resource. Highly recommend using it as a way to, get a picture of what homes may be best suiting your loved one's needs before you even do a visit. Pop back in over here. All right. So now, say we've decided nursing home placement is right for you. You've talked to the experts. You found out what you or the individual you're helping is looking for in a long-term care facility. And you've looked at a few facilities on Care Compare, and you've got a list based on the distance, the nursing star rating, and reports from people who may have had previous experiences there. But there are still things you can do to make sure that before you make your final decision about nursing home placement, I'd suggest visiting the nursing homes themselves. Now, you'd be surprised, and you can learn a great deal about nursing homes just by taking the time to get some eyes on and see what the daily operations actually look like. By taking the time to actually being present and observing the facility, you're going to be able to get a true glimpse into how the staff at the ground level are interacting with the residents. You'll potentially have the opportunity to speak with other residents or other families to get a good full understanding of what's life like for them in this home. And I would note it's worth consideration to visit the homes maybe a second or a third time, maybe on the weekend or the evenings, times when many nursing homes reduce their staff and services. If at all possible, take the prospective resident to the home before any decision is made. That way, this visit gives you an insight and the ability to discuss in real time with the prospective resident their feelings about what the vibe the home gives them and what they like, what they don't like. It gives you a chance to better team with the individual to make sure that their desires are met and their fears are eased. Medicare and National Consumer Voice have some fantastic facility checklists and guides for conducting your in-person visits, so you can make sure not to miss any aspect of care or life while you're there. But I'll highlight some of the things that you can look for and ask while you're completing these in-person visits to make sure that you are getting a good idea of what's going on. So, what to look for? Using your senses. You know, do you notice a quick response to the call lights when they're coming on? Are the residents that are calling out and the staff respond quickly? Do the meals look appetizing? Are the residents eating their food? If the resident needs help eating, are staff patiently assisting them who need it? Are the residents in physical restraints or in chairs or wheelchairs? Do the resident rooms reflect that individuality of the occupants? Does it feel like a home? Does it look like a home? Does it smell like a home? Are the rooms and hallways clear? Is it noisy? Are the staff cheerful and pleasant when they work with their resident? Does the administrator seem to know the resident and enjoy being with them? And does the resident enjoy being with the administrator? You know, anybody can put on a front. The residents don't always have to hide their feelings in that way. So you may get a glimpse of something like that while you're there. And things you can ask the staff, you know, does each shift have enough help to be able to care for the residents as they'd like? Do they enjoy their work? You know, ask them, what activities are the residents involved in? Ask if they're using temporary staffing agencies. I know with the coronavirus, staffing has been a huge challenge, and the accountability and difficulties in maintaining a regular staff or designated staff to designated units has been incredibly difficult. And the use of pool and agency staff is at an all-time high. You know, what does the facility do? You can ask the administration, what does the facility do to encourage employee retention and continuity? And you can ask staff, has there been any recent changes in ownership or management? That also speaks to that continuity of care and to ensure that the staff and individuals caring for your loved one know their intimate needs and desires as well as you may do. And you know, things, again, when you're there, you might be able to talk to other residents or families. You know, do they feel they're being treated with respect and kindness? Do they have choice in their schedules? What time do they get beds? What time do they get baths? What time do they get meals? Is there a family or resident council? Does the residents feel comfortable in raising grievances or concerns? And do they feel like the facility is receptive to helping them resolve issues? Has a resident or family reported any missing possessions? And do they feel that the facility is prompt and appropriate in responding to replacing or reimbursing them for those items? Do they even know who to speak to about those things, and who follows up, and do they follow up? These are kind of things that you can ask while you're there to get a good idea of, am I getting this quality care? Am I getting the care that I know I need, I know I deserve in a long-term care setting? So we're almost there. we think we've confirmed where we would be considering going, and we're ready to take those next steps. But as I mentioned at the beginning, there are still some twists and turns yet. I'm going to wrap up this next section by summarizing some of the processes, timelines, and resident rights and regulations as they pertain to submitting applications, looking at wait lists, deposits, and facility contracts. So first off, you're going to want to apply to each of the nursing homes that you're potentially interested in. And you may want to know, how do I apply for a nursing home? All right, so nursing homes must provide an application for anyone who asks. Obtain the applications for the home and complete them and return them to the home. If you're hospitalized, the hospital social worker or discharge planner is responsible for requesting applications on your behalf and assisting you, your family, guardian, or conservator in completing the application. What are the steps in the application process? So when you request an application, the nursing home must send you an application and dated receipt within 2 days. The nursing home will place your name on the dated list of applicants. This list only shows that you've requested an application and that it's been mailed to you. When you receive the application, you must fill it out and return it to the nursing facility. When the facility receives your application, it will place your name on the nursing home facility wait list. It is not until your name is placed on the wait list that you will be considered for a bed in the nursing facility. The nursing home will not place your name on the wait list unless your application is substantially completed. So what financial information can a nursing facility request? A nursing home may ask you if you have private insurance that will pay for the nursing home care, or if you are entitled to Medicare or Medicaid. A nursing home may not ask for financial information to show that you are not eligible for Medicaid. And once you're on the wait list, when will you get admitted? So generally, a nursing home must admit applicants on a first come, first served basis, based on the date that the home receives the completed application. However, Connecticut law does provide that if a nursing facility is at 70% or more of beds occupied by Medicaid recipients, or the only room available is a private room, the facility may refuse to admit the next Medicaid applicant on the wait list. However, the nursing home may not keep a bed empty for more than 6 months waiting for the next private pay applicant. In addition to discrimination against those covered by Medicaid, there are many exceptions to that first come, first served requirement. For example, you should be allowed to get admitted to the facility sooner and skip the wait list. For example, if your spouse is already a resident in the nursing facility, or if you're going for short-term rehab or respite care, or if you're in a different facility that might be closing its doors. There are several other reasons why you may be able to skip that wait list. In the object of time, I provided the list at the end, but we don't have to review all of them at this time. And so you wonder, how long will it take before you're actually admitted to the home? And this is where it's difficult or impossible to know exactly when you're going to be offered a bed, depending on that wait list line. How many people are ahead of you before the bed becomes available? The nursing home must inform you of your place on the wait list, wherever you are on it, whenever you request it. And if you're wondering, can your name be removed from the wait list? Once your name is on that wait list, the facility cannot remove it unless you've been on the wait list for at least 90 days. The nursing facility writes to you asking if you wish to remain on the list, and you do not respond to that letter within 30 days. Now, if you do feel that you're being improperly denied admission for one reason or other, you certainly can reach out to our program, and we can reach out to the facility and investigate. If you think you're being improperly denied admission, you also always have the right to legal services. So contracts. Should I sign the admission contract that the nursing home gives me? So since the obligations of the nursing home are specified in law, there may be no need to sign the contract. Many nursing home contracts are designed primarily to limit the responsibility and liability of the home. It's generally best to avoid signing a contract if you can. Keep in mind that a resident who has moved into a nursing home can never be forced to leave simply for refusing to sign the contract the home offers. Certainly, if you have any questions about a contract, discuss these with an attorney or feel free to reach out to the Ombudsman program. Like any other contract, you can kind of negotiate the contract terms and be particularly concerned about language that limits the home's liability. the resident's right to sue or request disputes be managed or handled through binding arbitration. Deposits. So when can a nursing home ask for a deposit or an advance payment? A nursing home may not require a deposit or advance payment if the nursing home care will be paid for by Medicaid or Medicare. Each nursing home must prominently post the limitations of deposits or advance payments allowed under Medicare and Medicaid, and obtain a written statement from applicants seeking admission to document their understanding of those limitations. Deposits for those covered by Medicare, right? So no deposit may be required of any resident whose stay is covered or partially covered by Medicare. A nursing home may, however, request deposits for services such as private rooms, private duty nurses, televisions, phones, and other personal comfort items that are not necessarily covered by Medicare. If you're eligible for Medicare and the nursing home thinks that your stay in the home will not be covered by Medicare, you must be given a written notice whenever a determination is made and that a facility stay won't be covered. And that notice must give you the option to have the bill submitted to Medicare for review of non-coverage decision. If you choose to have a bill submitted to Medicare, you cannot be charged until Medicare sends you its decision. If you do not receive a written notice telling you that your stay has not been covered, you cannot be charged for those services you received. Lastly, deposits for those covered under Medicaid. If you are already receiving Medicaid, the nursing facility may not request any deposit or advance payment from you. Now, if you've applied for Medicaid but have not yet been found eligible, your stay will not be covered by Medicare, the nursing facility may only request a deposit or advance of payment of no more than $1,500. If a deposit is paid, it must be held in an account for your benefit and must be returned to you when your Medicaid eligibility has been established. So we did it. We've applied to facilities. We've gotten the call. They've been willing to accept us. We're going to get in. I want to make sure that once you get admitted and you've now entered the nursing home, that you know how to get good quality care. And, Lindsay recently did another education series that I think is super big about this, about quality care planning. Another great educational session. I highly suggest watching that. But also, just some quick summaries about some tips and tricks to make sure you're getting that good quality care, right? So first, visit frequently and encourage others to visit. It's with that family oversight that you're able to really confirm that individuals are getting that quality care that they need. Speak up and raise concerns and complaints. Let the administrator know. Feel free to reach out to the Ombudsman program or the licensing agency. Individuals have the right to raise concerns or grievances without the fear of retaliation. As mentioned, attend that quarterly care plan conference and advocate for individual person-centered care. Follow up on the agreed upon care plan. Make sure the resident doctor knows what is in the plan. And notice if the plan isn't being followed and request another meeting if necessary. Get to know the staff and help them to get to know the resident. Share details in writing about the resident's likes, dislikes, and daily routines. Participate in family council meetings. And if you're the resident, participate in the resident council meeting. Or make contact with your local community's long-term care ombudsman. Any local citizen advocacy group that becomes familiar with the state and federal laws can help you to better flex your rights. And document. If there are issues or problems that come up, date the time, people, person involved, and any problems that you might observe so that managers, the Ombudsman program representative, or the state survey agency can investigate and substantiate any concerns raised. So again, if this is your first time watching a program from us, I'm Dan. I'm a regional long-term care ombudsman with the Connecticut Long-Term Care Ombudsman Program. We're a 100% confidential program, happy to educate, advocate, or investigate regarding any particular resident concern or problem to their satisfaction. You can feel free to reach out to us multiple ways. You can get us on by telephone, 1-866-388-1888, email at ltcop@ct.gov. I've got a link to our website as well as our Facebook page here. So if there's any additional questions or concerns, you guys can always feel free to reach out, and we're happy to help you however we can. And again, thanks for attending tonight. I've got here all the links to all the resources that we talked about by kind of category, I guess it were. The long-term care planning resources, choosing a nursing home resources, including like Medicare's nursing home checklist, the National Consumer Voice Guide to getting quality care in a nursing home, the state DPH survey lookup tool, so you can see if the Care Compare doesn't have it, maybe there's a more recent survey updated there, as well as the nursing home and facility testing data to find out if there's been any recent outbreaks in the facility, and the link to the Long-Term Care Community Coalition. They also separately post the staffing levels by state and facility for facilities. And then again, I posted here links to the specific statutes and regulations as they pertain to admissions, wait lists, contracts, and deposits, all listed here, as well as links for further reading. And for those who are really into it, if you wanted to get a copy of the presentation afterwards, I've got some of these federal and state statutes and regulations listed here. So you don't even have to do too much digging to look into them. So again, I mean, this has just been a pleasure to be with you guys. Here's the list of the full list of wait list exceptions of why you might be able to skip a wait list. For example, if you were discharged from the home within 15 days and requesting readmission, or if the residents say, for example, returning from a hospital stay, are two examples why you may be able to skip that wait list. So again, thank you guys so much for attending tonight. Again, my name is Dan Beem, the Regional Long-Term Care Ombudsman. Look forward to working with you. Have a great day.